What's up, rookies? Welcome to another snippet on what pharmacists do. I don't know if you recall Dr. Dr. Sebastian Alseigh. He was my first pharmacist guest on our What Pharmacists Do series. He had been here to talk about a pharmacist's role in the emergency room setting. We follow each other on social media, and you posted something, Dr. Alseigh, a patient's feedback and recognition to you towards a role that you played in the care of one of the family members. And I wanted you to come on and tell us the story, because that was a true example of a pharmacist going above and beyond the call of duty and really making an impact on patient care. First of all, thank you for coming back on. Welcome. I know you're just coming back from a long day at work, and I so appreciate you. How are you doing?
I'm doing well. Been busy as usual in the ER, and so, but I'm excited to be back. Thanks for calling me back.
Yes, you've been doing your thing in the ER. And I'm going to go ahead right now. I'm going to start by reading that message that the patient's family member sent you, and then you're going to tell us the story behind that.
Sure,
Sounds good? Okay, I'm
sure.
going to read it. Hey, Sebastian, this is so-and-so's husband. I wanted to reach out to you and say thank you for everything. The love and compassion was remarkable. You helped my wife get through this and helped save her life. I was not sure I was going to see my lovely wife again. My kids were not sure they were going to see their mom again. The last images we saw was not what we wanted to be the last we saw of her. You are truly what the world needs more of. I genuinely want to say thank you from the bottom of my heart, and thank you for continuing to look after her long after she's left the emergency room. You did more than just your job. It means so much. I will be forever grateful for you, and I will never forget it. This is a patient's husband sending you this message after your wife had been in your care. Can you please share with us what happened that day for you to have such an impact on this family?
So this was a patient, a relatively young woman that came into our emergency room. She was having profound stomach pain, and she was having some really bad nausea. And so we at first thought she was having some sort of stomach issues, some stomach bug, maybe some
Mm-hmm.
diverticulitis, maybe, and
Okay.
so some inflammation. So we took her to the CT. The CAT scan, sorry, was
Yeah.
negative for
Yeah.
really anything in her abdomen, but she continued to complain of severe pain, and she was, very, very uncomfortable, and she just
Mm-hmm.
couldn't. And we noticed that her oxygen was a little bit low, so we were giving her oxygen, and then she mentioned that she was having trouble breathing, and then also we noticed some of her labs were a little bit out of whack, and so I noticed one of the labs called the troponin enzyme was kind of elevated, which for someone her age, it wouldn't be typical for it to be elevated like that. And
Yeah.
so we sometimes see that in heart attacks,
Yes.
but other conditions can cause that as well. And so, I talked to the provider, and we ended up ordering a CAT scan of her chest because the X-ray of her chest didn't show any kind of a pneumonia or any kind of infection. So we
Yeah.
did a CAT scan of the chest with some dye, and what that revealed was that she had a blood clot in her lungs, in both sides of her lungs, in both arteries, or sorry, and some veins. And so essentially what we found out, it's called a pulmonary embolism. And so, and that usually can happen via a blood clot in your legs, also called a DVT, which we
Yes.
found out that she had been having leg pain for a while, but she has also been having leg pain for 7 weeks because she has torn her ACL and some other issues with her knees, and so
Mm-hmm.
she's been immobile and hasn't been moving around. So and so she attributed her pain in her leg to just her regular pain, and so
Yeah.
that
Mm-hmm.
clot in her calf then broke off and went into her lungs, and it caused a blood clot. And so her blood pressure started getting a little bit low as well. And so what I provided for her was I was there explaining to her and the mom of what's going on,
Mm-hmm.
and the nurse was there with me as well, and I was able to, find the physician and say, hey dude, we have a pulmonary embolism. And I started obtaining orders, because pharmacists can put in orders depending on what state you're in. We can actually enter orders
Mm-hmm.
from the doctor. So I found a doctor. He was seeing another patient. I said, this is what's going on with the patient. I need this drug, this drug, this drug. Her
Mm-hmm.
blood pressure is low. I also need this medication. He's
Mm-hmm.
like, okay, let's do it. And so I was able to expedite the care. And then the next day I went and visited her up in the ICU, and she was completely better. She actually had a procedure done where they suck out the clot. And
Yeah.
so I saw her in the ICU the next day. She was doing well. And then I also saw her about a couple of days before about the day she was being discharged. I'm sorry.
Mm-hmm.
And I was talking to her about some of the medication she's going to be going home on. And I also found one little mistake that the provider had made on a discharge prescription. So I was able to get that handled. And so she ended up doing well, and
Going
pretty
home.
much within 2 days made a complete recovery. And so that's why the husband had sent out a message, thanking not just me but the whole staff as to what we
Mm-hmm.
were able to do. And she herself even said that, I was very clear in explaining to her and her mom, because sometimes in healthcare we tend to, not really explain things very well because we're in a rush. We use a lot of medical words.
Yeah.
And
Yeah.
so I was
Yeah.
able to kind of break it down for the mom, and break it down for her as to exactly what's going on and what the plan of care is and what the medications we're going to be giving her are all about.
Yeah. And that was not a typical presentation for a pulmonary embolism.
Exactly. So, typically they present with shortness of breath, maybe. Her heart rate was elevated though, but when you're complaining of abdominal pain, she was in so much
Yeah.
pain, she couldn't really tell us right off the bat that her calf was hurting. And so we had no explanation as to why her oxygen levels were so low, because her x-ray was completely clear for her lungs. So the only other thing was to make sure we checked for a PE, or pulmonary embolism.
And you placed the orders
I put
and
the orders in. I helped the nurse do the math for it. I got it started. I reassessed. I got some medications for her blood pressure. I discussed with the provider the need for potentially another medication, which is a clot buster, because her
Mhm.
blood pressure was getting kind of low. And in
Mhm.
those cases, there's even stronger blood thinners that we do give the patient that can help dissolve the clot. And
Yeah.
so we kind of
Yeah.
made a plan with the doctor that if her pressure dropped again, we would have to give this medication, which is very dangerous, but can also save her life. And so she actually ended up doing okay enough to actually go to the procedure area where they went and basically sucked out the clot.
And how does the husband know all of this? Is he there seeing you interact
Oh,
with the
so the
provider?
mom, so the mom, the mother was there, who was obviously calling the husband, giving her, because she had passed out at home, and the kids had seen her in the bathroom and called 911.
Ooh.
And so both her kids saw her passed out in the bathroom, and this first time she passed out, she didn't want to go to the hospital. The second time, she completely face planted in the bathroom, and her kids were like smacking her, trying to wake her up. Her husband's trying
Oh
to
my
wake
goodness.
her up, so they call 911. And so what happened was the patient um, ended up telling, obviously saying, hey, the pharmacist Sebastian, they kept mentioning my name, was a really good guy.
Because the message he sent you doesn't say, because you say he sent it to the whole team. This message says Sebastian. It was to you.
Exactly. And so, I
You're
mean,
being humble here. You're being modest here.
I'm not here to take credit for, because it was a team
I
effort.
know, I know,
We,
I know.
you know,
But this is about
we
pharmacists.
we play a role. We play, we play our piece, and we make sure that all the pieces of the puzzle are fitting okay. And sometimes we're having to be the nurse. Sometimes we're having to help the nurse out because the nurse has 4 patients, and so sometimes we're having to be that communicator because especially in the emergency department, we're there physically at the bedside. And we have a lot of authorities to put in orders, to check vital signs, to order labs, to
Yes,
interpret labs. And so
yes,
we
yes,
sometimes are able to see them before the physician does, because he's seeing somebody else, another patient. And
yes.
so I'm able to rapidly assess the labs and take a look and see, oh my God, this is not a normal lab. Let's do this and let's do that. And it kind of helps
Move
shorten
things
times.
along a little faster. Yeah.
Yeah, and getting the medication, getting it approved, putting it through, doing the math, ordering the right labs, and getting something as stupid as a pump for the patient, for the nurse, going and finding a pump,
Yeah.
bringing it
Yeah.
to the
Because
nurse.
this is the critical situation. You have to move as fast as you can. This patient has passed out twice already. And the patient describes not the status of the patient not being the image of the wife he wanted to have. not being the last image, which means she
She
was
was
bad
she was
shape.
essentially her skin was basically pale. She was
Oh,
gray. She was,
yeah,
within
yeah.
I think that had we delayed this maybe another hour and a half, she probably would have her heart would have
Yeah,
probably stopped, and we would have had to bring her back. And so
yeah,
luckily things
yeah,
aligned as they did.
yeah.
And so her husband was very, very thankful and reached out to some of the administrators to kind of say thanks as well for bringing her back or getting her
Wow,
right
wow.
away.
And that, guys, is what pharmacists do, baby. Sebastian, that was awesome. And I mean, this is a perfect example of how a pharmacist works together with the healthcare team to improve the healthcare of a patient. So, what do you have to say about two people who think that? I mean, the role of this video is to educate not just the public but aspiring pharmacists about what they could possibly be doing, what kind of impact they can possibly be having. So what do you have to say to those who think that pharmacists just dispense medications regardless of the setting?
I mean, for one, the public, I don't blame them because all they're exposed to for the most part are, the retail pharmacists at, CVS. And then,
Yeah,
you
true.
know, if you're part of some organization like Kaiser, you may actually be seeing a pharmacist for your care of your diabetes. And so that
Yeah, yeah.
they're in that kind of a role. It's more of they work with the doctors in their offices. And then a lot of patients that come to the hospital, depending on where, what unit you're in, you may not see the pharmacist, unfortunately.
Fortunately.
Um, and so the, the public's image of what we are and what we do can be a little limited. And so, after 6 years of doing this, I'm kind of happy that somebody outside our little bubble can, recognize what we do and what kind of
Yeah.
what role we played in their patients. And so for
Mhm.
those who are wanting to, people are shying away from pharmacy only because there's, they're looking at the way retail is and that it's usually, understaffed and overworked. And there's a lot of vaccine quotas and other quotas that these big corporations are putting out for them.
And
And
underappreciated.
and underappreciated, and patients themselves are impatient, and they're upset, they don't want to wait 2 minutes. And so really my hats off to them. But the people that really want to stay away from the profession because of that, may not really see the green side of things or the other side. I mean, I absolutely love my job, and though I'm lucky to be where I am at the department through many years of training and my ability to be there, but there are more gratifying roles. There are roles in the hospital setting and in the other settings such as ambulatory care or
Yeah,
maybe insurance companies. And
yeah,
there's so many other roles that you're not limited to just working in the outpatient setting.
yeah.
And so, and sometimes doing what I do, which is being in front of the patient, is kind of more rewarding because I'm seen as a member of the healthcare team. I'm seen as a member of I'm like the physician's kind of like buddy in a sense where
Yes.
he or she can run, a differential by me, or he and she can say, what are your thoughts on this? And I might say, hey, did you consider getting a CT of this, or did you consider this? Because he goes, oh shoot, I didn't think about that. And medication mostly, obviously, hey, did you consider this medication because of X, Y, and Z? And
Mm-hmm.
it's, you know what, I didn't think about that. Let's give that and give it a try.
Yeah.
And so, there's little facets like that where the providers then the doctors become your friends, and they become kind of trusting of your opinion. Versus in the nursing setting, the nurses are used to following orders, and they're used to taking care of the patient on a more physical level and
Yeah.
assessing the
Yeah.
patient.
Yeah.
Sometimes the decision making is left a lot to the physician, and when we're there to aid the physician in their decision making process, that always improves patient care. And there's a lot of evidence and literature out there that shows that when a pharmacist is present, whether it's in the emergency room or even at the
Mm-hmm.
bedside, you
Mm-hmm.
know, you'll see the
Mm-hmm.
literature shows that there is a decreased time to delivery of certain medications,
Yes.
and even decreased pain levels. And right now, there's a initiative by Medicare where in 2025 they're going to start penalizing hospitals for patients that have blood sugars that are over 200. and 300 that are not being managed. And
Yeah.
pharmacists in this regard, I know a couple of colleagues that are experts in blood sugar management, and so what those doctors will do is they will essentially turf all the sugar management to the pharmacist and say, hey, it's your
Yes.
job to
Yes.
start insulin. And so those
Yeah.
are things, that's how where our profession is moving forward in
Mhm.
that sense. Just unfortunately, hospitals don't always have the right mindset to advocate for us. And luckily, I have wonderful leadership that is able to,
Mhm.
push those,
Mhm.
you know, corporate and push up to the higher levels that, hey, our pharmacists here make an impact on patients. And here are the 10 things that they do
Yeah.
that, and to show our worth. And unfortunately, it's the times where we have to prove our need, and we have to prove our worth, even though you ask anybody in the hospital and they love us,
They
financially
do.
financially you have to prove that you need to exist versus, a
Yeah.
nurse who needs a nurse, everybody needs a doctor. But they go, well, what does pharmacy do? All they do is give us the meds. But so you have to do things like this, really establish your presence.
Yeah, yeah. You hit it right on the nail when you mentioned advocacy.
Mhm.
Um, Hospitals, organizations really need to advocate for pharmacists. And in order to do that, they need to feel the impact that pharmacies have in that system. And most of the decisions are financially based. And you mentioned studies that show the decrease in delivery of medications, better blood sugar control, and also there's studies about financial savings, about cost impacts. And and also we as individual pharmacists have to advocate for ourselves. I think you coming on and sharing this story is a form of advocacy. Hopefully many people get to listen to this and realize that if blown up to a bigger setting and having pharmacists impact this way in a bigger settings, pharmacists will be not pharmacists, but patients will be better taken care of. I like how you mentioned students or aspiring pharmacists shying away from the profession because of XYZ, and you went over a lot of the impact that we can have. So what advice do you have for people aspiring to become pharmacists who have that mindset? How do they um get started and get through and become pharmacists and make the best
Well,
out
first and foremost, I would say those who aren't passionate about what we do shouldn't even don't even I don't want to say don't even bother, but I say, this is a lifelong profession. And so, yes, we can change our careers, but for those that actually know what pharmacists do and they've researched and they've maybe shadowed a couple, or they kind of know what we do, don't stop. I mean, the sky's the limit. I've gone through a few different iterations of in my career. I've had my ups and downs to get to where I am, and so
it.
it took maybe 2 or 3 years. I'm on my fourth year now in the emergency room, but it took a couple of years for me to really find the right niche for myself and push for myself. And so, I
Yeah,
was never one, as you remember, I was never one to shy away from asking questions and really putting myself out there.
I know.
And so your dedication will shine over others. And so
Mhm.
really the sky's the limit. I mean, if sometimes you have to go a little bit out of state, if you have to geographically change a little bit
Which
to
you
get a
did.
better, I mean, I did my
You
residency out in
did for your
Ohio.
residency. Yeah,
I
yeah.
did it out. I did it out in Ohio, and so that was some of the best times I've ever had. But you know, uh, our profession is getting more progressive in California. More hospitals are starting to realize the value of adding us,
Mhm.
but that doesn't always translate when it comes to students. They all kind of see the bad and the negative, and they get shunned away from it. So never
Yeah,
give up is what I tell people. I mean,
yeah.
if you want it, anything. I mean, we have friends that were, had three different careers. If you remember Eric, I mean, he had 2 or 3 different careers, and then he started school in his mid to late 40s, and now he's happy with whatever he's doing in life. And so,
Yeah, we had classmates who were into music and turned to pharmacy and were one of the best students in the class.
And so honestly, you can never. But if you're if you're having an inkling to become a pharmacist and you kind of know what we do, You can always ask to be a shadow. There's a lot of hospital programs that offer, volunteers to come and take a look at, the hospital.
Mm-hmm. Mm-hmm.
Ask, and pharmacy is a small world, so you can ask me, you can ask Brigitte. I'm here in
Yeah.
the,
Yeah.
central. I know people in Southern California, and you say, hey, I want to see what a hospital pharmacist does, and I want to shadow, and you get to see those different facets, and you go, maybe you can dream yourself being in those positions. Then, you certainly go for it.
Yes, yes, absolutely. So you said two things. I'm hearing two things here. If you are passionate about it, don't let anything stop you. Don't let what is happening, or what you see happening from the outside looking in stop you, because we are all unique. We're all individual. We all have our unique talents that we can make work regardless of what the market looks like. So you're passionate, don't stop. And then ask, be curious, try to figure out, dabble in, volunteer, so you can better understand that what it is that pharmacists do, and confirm that it's something that you're truly interested in. And
Don't let naysayers push you away. If I were to listen to every critic I've ever talked to, or every person, I probably wouldn't be here. You can listen with with an open mind, but also, a lot of people are speaking from their own like bad experiences, and they're kind of burnt out. And
yeah,
so just, take it with a grain of salt, but also listen and say, okay, well, maybe this particular, location isn't for me. But don't let them push you away, because the profession is huge, as you know. There's like hundreds of different jobs that can be done.
yes, absolutely, absolutely. So well said. Thank you, thank you, thank you for coming in and sharing this. I am so proud of you. I've known you for so long. I know how much having an impact and doing the right thing and being knowledgeable means to you. And I think this message from this patient, must have felt, really, really, gratifying for you, because I know how hard you have worked for it and how hard you continue to work for it. And I thank you really for coming and sharing this, with us, because you just got off work, you just got home, you must
That's
be.
okay.
But that's passion right there. That's what pharmacists do. Thank you, thank you, thank you. If you have any questions for Sebastian about being a pharmacist, in the emergency room setting, please let me know. I'll help you connect with Sebastian. And if you like our conversation, if you like our videos here on the What Pharmacists Do series, please subscribe so you can be notified every time we post a new video and not miss a beat. Until the next video, God bless you. Stay tuned. I love you. Bye-bye.
Bye.